You to just come here to see how this city has developed. I'm even calling it a city, to see what has happened in the hospital here. I really want from the bottom of my heart to congratulate the county government of Kericho. I've been seeing you've been winning awards left, right, and center, you know, on governance, on ICT, and that kind of thing. It is not an accident, and it's not by fluke that you're doing as well as you're doing. So congratulations, Your Excellency, for all the great work that county government has done for your people, and also congratulations to the CEC Health, and of course, congratulations again to Dr. Langat for what you've done in the health space on this. Now, I take this opportunity to also thank the teachers and their able representatives who make sure the oil of the scheme works very well, and we are kept on our toes with regards to management of the scheme, and that's the union officials. And for Kericho County, again, special mention to Madam Mary Rotich for making this happen today and engineering all this on our behalf. So thank you to all the teachers of Kenya and the Teacher Service Commission for entrusting us, for entrusting their health to us. We don't take this as a commercial job only. Actually, in the big part is there can't be a more important duty than people entrusting their health to you, just as what is more important than me entrusting someone with my children to educate. So we do take it with equal seriousness, and we thank you for the opportunity to serve you in that space. And I want to promise you all that we are doing our best, and we promise all the teachers that we are doing our best to ensure that you get the best. Again, just probably in quick response to what I heard from the Kesha team leader about the areas we need to improve on the administration side. That's well in place in terms of the plans that we are having on that. You know, with regards to, you talked about the approval, the 7-day rule, the capitation limits, all that is under review, and I can assure you in a short period of time, you'll never be hearing about those issues. Secondly, it was mentioned about mental health. Again, very, very important about mental health. We actually just launched a program which you'll be seeing going on quite a bit. But let me say, for mental health, we actually already do cover mental health care, psychological and psychiatric care for teachers. That's already in cover, but we are now coming up with a program to amplify the message of there is help, a phone call away, there is help next door for anyone who's suffering from any form of mental health, and we'll be talking more about that. And just for information, again, hearing the cry of the teacher that they need facilities to the very last part of the country. So far, actually, we have so far contracted and we have made agreements like this we are having today with over 70 county and national government facilities, and we are continuing on that path. So we are open to feedback on your experiences, and we really thank you for what we've had today. So it is my great pleasure to be here today to witness the commissioning of not one, but 6 Kericho County government facilities into the panel to serve the teachers under the Teachers Medical Scheme. And these services that are going to be provided there are all possible services under that particular facility. For example, here we have the specialist outpatient care. Someone mentioned, can we have access to specialists so that under one roof you can be able to see a gynecologist, you can be able to see a pediatrician, you can be able to see a nephrologist, a cardiologist if they're there. And that has been now facilitated here, that there will be outpatient specialist facilities, even as we work out on the normal casualty one. Inpatient care, dental care, optical care, maternity care, renal care, all the imaging and the fantastic imaging centers that we've been shown today. Remember, as again was reminded here, this scheme does cover all teachers for road and air ambulance. If there's a problem, a distress in any, say for example, remote place or emergency, we send helicopters, we send fixed wing airplanes, never mind the road ambulances. We also have, again, on mental health, we have what we call wellness program for teachers, which we are trying to amplify so teachers can know more about this. We actually do have a 24-hour, what we call 24-hour psychosocial telecounseling center, a toll-free line that teachers call in for any mental health issues. They call us, we help them with their online psychiatric help, and then now we connect them to physical, in-person and one-to-one psychiatric help and counseling services. So that is already there, but we need to bring it up more and more. Never mind the fact that also all teachers, we do assist them when there's a bereavement with what you call funeral cover or last expense cover and life insurance cover. So all of these covers, I can say again, I want to thank TSC for being the key facilitator for this, for enabling all this, and would not all be here were it not for TSC's vision and TSC's magnanimity with regards and care and love for their teachers. So this process, as you heard before, started about a year ago in June 2021, and this was actually at the peak of COVID-19 pandemic, when other accredited facilities were stretched beyond limit with COVID-19 related admissions. So having witnessed the support that many of our clients received from government facilities, at that time, we made the decision to partner with government in order to efficiently serve Kenyans. And once again, thank you to the county government of Kericho. It's one among the few that have had the vision to partner with us in the private sector to provide care for teachers and even other clients. And I can tell you it is not to be taken for granted, because government systems might not necessarily easily overlap with private sector systems. And for Her Excellency, the Deputy Governor, Dr. Langat, and all those who are involved to enable us to be here today, we must take cognizance of that. So the exciting process between the county government and Minet has culminated, again, as you've heard, in the contracting of the following facilities. Here in Anamoi Sub-County, we have, of course, this wonderful, excellent and beautiful Kericho County Referral Hospital. We have Londiani Sub-County Hospital, Roret Sub-County Hospital, Kapkatet Sub-County Hospital, Soinsigoet Sub-County Hospital, Tanan in Kipkelion West Sub-County Hospital. So to ensure we deliver a delightful customer experience, we have trained personnel in all these contracted facilities on various Minet processes, such as the use of online and real-time systems. We are completely and fully digital. And again, really kudos to the Kericho County Government health teams, because even as we were walking around there, everything is digitized. The imaging and literally nearly everything is digitized, and that's why it was such an easy fit for us to be able to actually establish the systems that we need to serve the teachers. So the online and real-time system, the claims processes, customer service, and issue resolution systems. We are confident that these facilities will provide quality services to our teachers and their dependents, not only in Kericho, but also in the neighboring counties. As again, Kericho actually, and even Bomet, they actually serve other counties. They are like centers of excellence where people from many other counties come here. So we do recognize that, and again, that success is not to be taken for granted. This is as a result of hard work and diligent investing by these counties. For example, we have reports that patients have had to travel all the way to Kericho town from Fort Tanan to access medical treatment. So I'm happy to report that this and such will now be an issue of the past. Teachers in Fort Tanan will receive treatment from their own sub-county hospital. Additionally, these hospitals will offer outpatient, inpatient, dental, specialized services directly without actually needing a referral. As you may be aware, the Minet-led medical cover has provided teachers with comprehensive medical insurance, including full coverage for COVID-19 treatment. We were actually the very first in the insurance industry when many did not cater for COVID. COVID came and shocked all of us, and your standard insurance policy excludes pandemic. Pandemic in and of itself are not insurable. So what happened is we decided to just take a leap of faith and said money is secondary to actually the health of our teachers. And we went and covered COVID 100%, both inpatient, outpatient testing and everything. And we continue to do so without any reservation and without any barriers to treatment for COVID. And we believe through this scheme, God has actually saved very many lives of teachers who things may have otherwise gone different. Myself, as everyone has said here, okay, I'm not a teacher, but I'm a product of a teacher. My mother was a teacher, having trained in, Mosoriot Teachers College. That's where she trained. So my mother was a teacher. I'm a product of the hard work of a teacher, and therefore I can attest to the role teachers play in the economic growth of our country. Teachers are the center of everything. We are all products of teachers. I normally say we are products of our parents, we are products of God, our parents, and teachers. Teachers are now considered frontline workers during this unique season of COVID, of the pandemic, and we are therefore committed to ensuring that they receive the best healthcare services without strain. Yes, there's always room for improvement with regards to administration, but I can tell you we are improving on a daily basis to ensure that we balance financial sustainability of the scheme so that we can guarantee Madam Langat immediate and quick payments. Therefore, you need prudent, disciplined systems with integrity and fast and reliable and good and pleasant services to the teacher. I want to assure all teachers that we are working towards onboarding more county and sub-county hospitals. And again, from what I heard from Dr. Langat, the idea of this is just a pilot and we are taking it to even lower levels, that is music and wonderful to our ears. So I want to assure teachers that we are actually waiting to onboard more county and sub-county hospitals. So even if you are late to the party, we are now in it, hands, legs, and everything, so that we can increase access to treatment for teachers. And we shall continue to partner with the county government in this endeavor. And I am sure, Your Excellency, you will continue facilitating this. So I take this opportunity again to thank the government, the county government of Kericho, for supporting us in providing quality and affordable insurance services to our teachers. We trust that these 6 new facilities will serve our teachers in Kericho well. On our end, we will continue to improve our services and uphold our promise to be your trusted insurance provider. Thank you very much. God bless Kenya. God bless the great Kericho County, and God bless our teachers. Thank you.